Everybody. It's 7 o'clock in Los Angeles, and this is a special webinar to me and probably to all of you. This is our 30th anniversary of the first fibroid embolization ever performed in the United States. And we've got two special guests tonight, Natalie, and we're just doing first names here, ladies, Natalie and Lauren. And can you hear me okay?
Yes.
Okay. All right. Well, I guess we should start at the beginning. That's my wife's always saying, can't you just start the story at the beginning instead of getting lost halfway through? Um, Natalie, I've tried to take you back about 30 years here because that was 1994 was the time that you became the first patient to have fibroid embolization in the United States. Uh, you had significant bleeding is what I remember. And what I also remember was it was so bad that we tried to stop the bleeding surgically the day before Thanksgiving.
Correct.
Yeah, and at least you didn't have to worry about cooking Thanksgiving dinner, right? Because you had an excuse. Yeah, no, I'm sorry, I'm just had surgery. So,
Yes.
but if you can take everybody who's listening back a little bit along with me. Um, how long had you known you'd had fibroids?
Um, Prior to the surgery, I knew probably about 6 months. I experienced the heavier bleeding, probably 8 months to almost a year before that, but it wasn't totally confirmed. Um, you know, I was switching jobs, new insurance, and so at least the surgery was in November of '94. So probably like April or May of 1994, it was confirmed that I had significant fibroids.
Now, 30 years ago, you must have been like 14 and I was like 20, right, at the time?
Yes, correct.
That's right. And I'm I'm going to stick by that story. But you had um, significant bleeding. That's one of the main symptoms of fibroids, heavy bleeding. The other one being pain and pressure. Uh, but before you came to find us at the Fibroid Treatment Collective, what had your other doctors told you your options were?
This wasn't pretty good. It was the option was to have a hysterectomy, and I kept saying I want to. I was young, have children.
I know you're 16, right, at the time? Yeah, yeah, yeah.
Exactly.
And there are a few people listening who don't know what these different names are. So hysterectomy for fibroids means you're removing basically the baby and the bathwater. You've got the healthy uterus, and you're going to take that out as well as the fibroids. There's another procedure called a myomectomy where you would take out the fibroids and leave the uterus. But both of those are surgical procedures with significant risks. Um, so most of the time, there's not much you can do with fibroids to slow down the bleeding. Did anybody offer you any alternatives to some procedure?
No, not at all. And then I had an appointment with Dr. McLucas,
Now,
and
how did you find us, Natalie?
one of my friends, she had just gone to you, and she referred me to you. And I said, "This has got to be like, a blessing in disguise," and it was. Um, so it was a referral, probably in the month of April of '94, and I made the appointment right away, and the rest is history. But it was a referral. A very good friend of mine. We're still friends to this day.
I hope so. I hope you send her a Christmas card every year, you know? I mean,
Oh
I
yes.
We had a recent patient, and not to get away from the wonderfulness of this evening, but I had a patient from Florida who I ask all the people who come to us, how did you find us? And she said, well, uh, that website chat APT, what is it called, Lauren?
Chat GPT.
That's it. Thank you, Chat GPT. They said that you're the fibroid guy. And I said, well, that's really nice. I mean, can I send them a box of chocolates? And she said, no, it's artificial intelligence.
Oh,
It's
wow.
you can't send anybody a box of chocolates for that.
Mm,
But yeah, so we got interested in fibroid embolization because the options are not so great. The options are a hysterectomy, which is going to mean no future fertility,
right.
and a myomectomy, which is, I'm a gynecologist. I have to tell you that after a myomectomy, there's a 50% chance that the little fibroids are going to become big fibroids. They're
Mm,
going to get big all over again.
mhm,
So neither one of those is a great option. And I first heard about fibroid embolization from a French colleague who had talked about his work in the early 90s in Paris. And it struck me as a pretty good option. But at the time that you and I met, Natalie, we tried to stop the bleeding surgically, and it didn't work. You were still losing a lot of blood. I mean, there was what I would call a leaky radiator. You pouring the blood in, and it's just going out the other end.
mhm.
And I remember very well talking to you, and you you said, "Look, I trust you, but I really want to have a family.
Right.
I don't want to. If there's any way we can avoid that hysterectomy, avoid taking out the uterus, I'm willing to try it if you are." And and that's where we were the night before
Mhm.
when we the what surgically it did not work to stop the bleeding. So I called my colleague Scott Goodwin, and he was having Thanksgiving dinner. It was Thanksgiving,
Right.
and he said, "Is it really important?" I said, "Well, it is to Natalie." And and he came in, um, and I think we told you that at that point we didn't have a lot of background to tell you anything more than this was the alternative,
Mhm.
the only alternative to having to do a hysterectomy because of bleeding. And if we can get back to that time, that's 30 years ago. I can't remember what I had for breakfast anymore. But um, is I can remember being in the room when you had the procedure,
Yes.
and we had some drains inside the abdominal cavity the blood was just coming out. It was like it was being recirculated.
Mhm.
And as soon as Dr. Goodwin blocked that artery, there was no more blood coming out. And that's when I became a believer. You
Yeah.
know, that's when it sounds like a spiritual, doesn't it? Yeah. But that's when I realized this was something really big. What was um, what was the recovery like? I know it was 30 years ago, but how difficult or easy was it?
It was extremely easy. I was expecting, I don't know what I was expecting, but something long term, more like 6 months, 8 weeks, not 6 months, but 6 weeks, 8 weeks, something longer than that. And I know it wasn't. And I believe I returned to work even within probably 2 weeks. It was just crazy. The whole thing. Able to return to work without heavy any bleeding.
Yeah.
It was just amazing.
Yeah. It really is. I mean, the first, as I said, the first time when I saw that bleeding stop, I said,
Mm,
"Whoa, this is something.
yeah.
This is something." I'm sure when you were told you had to have a hysterectomy, that wasn't something that you wanted. I mean, how did you feel about that?
It was devastating. I just remember tears, and my fiance at the time, we just, didn't understand it really, the whole process, but everything we read sounded very negative, um, and the hope was very slim.
Yeah. Well,
Slim.
there's my grandfather used to say, necessity is the mother of invention, and that's sounds like a bit of an old grandpa's tale, but that's exactly what we had. We had no other choice,
Yeah.
and um, and that was the beginning of the story. And you were you obviously didn't know when you came to us about fibroid embolization because uh, we you were the first case.
Yeah. Cutting edge.
Yeah, you were the tip of the spear, or whatever they say these days.
Yes. Thank you.
Yeah, yeah. It was. We were both jumping off that cliff with hopefully a parachute that was going to open up pretty soon,
Mhm.
and fortunately it did. So, how soon after uh, the procedure on Thanksgiving Day, 20 or 1994,
Yes.
did the bleeding stop?
Um, Basically, immediately, my periods became regular, very light. They were always light prior to having fibroids. And it was just like a whole new world again. So I knew that it had taken it had taken shape. And then after that, they've always remained light or in control. Before that, it was out of control for at least a year, I believe, maybe a year and a half.
Yeah, you were really anemic. Yeah.
Yes.
I mean, what one of my patients said, it's a monster menstrual. It's that's what it is. Yeah, yeah.
So,
So
yeah.
go ahead.
No, I was just saying it was horrible, the experience leading up to that, to the surgery.
Yeah, yeah. So obviously, motherhood was something that you were hoping for,
Yes.
and who is this person sitting next to you? This is a race car driver in training. Is that right? Am I right about that?
To be, yes.
Yeah,
This is the result. Yes.
yeah.
My daughter.
And and it wasn't you didn't get pregnant right afterwards. How many years passed before you
Uh,
conceived Lauren?
so that was 94. I got married in December of 95. And then we really just started trying from there. And she was born in 1999, March 1999. So a
Okay.
couple of years after.
Yeah. Yeah. And I should tell people who are listening and thinking about maybe having a myomectomy that we tell all the patients who have a myomectomy to try and get pregnant within 6 months because the fibroids are going to grow back.
Mhm.
And, obviously for you, they didn't and they don't. That's one of the really wonderful things about uh, embolization. It's a one and done
Mhm.
procedure. So, um, Lauren, what do you think about your mom's decision to hold on to that fertility?
I'm grateful. She's everything. I mean, I didn't know her before, but she's everything anybody could ask for or hope for in a mom, a confidant, a friend. So I'm just grateful that this is who God chose for me. And without you and your the other doctors and and everyone to help and do the research and the science and actually perform the surgery, I wouldn't be here and I wouldn't be able to experience this love that she gives and shows to me every day. So I'm just forever grateful for that. And I always tell her, like, I was your choice, so here I am. Whatever I do, this is your choice to have me. So we both live with it. But it's been a great 25 and a half years so far. And I mean, I love my mom beyond anything in this world. And yeah, so I'm glad she held on her fertility, as you said. Yeah.
Amen to that. I'm going to record this and send it to my kids so they when they're next time they're treating me bad, I'm going to say, why can't you be like Lauren and Natalie? I mean, it's not that hard to, you know.
There's I mean we're mother and daughter. Our relationship is our relationship. I'm sure it's no different than other kids to parents, but I just think I've gotten to understand a little bit the process she went through to have me because of how much she desired and wanted to bring a child into this world and mother it through life. Um, I don't know. It's different. I guess I'm lucky. We're lucky to have each other, and I don't know. We're with who we're supposed to be with in this relationship. So I don't know. I can't help but smile when thinking about.
You should. You should smile. You know, that's and I have to tell you, ladies, that there still is this, I don't know, fake news, if I can say that, you know,
Yeah.
after embolization, you shouldn't be able to get pregnant. Well, tell it to the judge. No, I mean,
Yeah.
our patients, 50% of our patients under the age of 40, sorry, have had a full-term delivery
Wow.
and healthy kids.
Hmm.
So there's no reason to look back because you know, you look back and smile at it. Um, and I do remember, by the way, your mom, you know, sort of grabbed my hand and said, you know, I trust you to do what you have to do, but I really would like to have a family.
Yes.
And you know, you stood up for what you wanted,
Yeah.
Natalie.
Yeah.
Yeah, and now you've got a race car driver in the family.
Oh,
No pressure, but
No pressure. No,
yeah,
no,
no
no, no,
pressure.
no, no.
Yes, I really need this baby. This, yeah.
Yeah, so wait a minute. She's always going to be a baby, right? Oh my God, you heard it here on this webinar, and now
Oh,
she'll be a grown woman
oh.
soon, you know.
yeah.
And you know, for people who are thinking about fibroid embolization, do you have any recommendations to tell them, Natalie?
Oh, Dr. McLucas, I've referred many, and I still to this day look up Dr. McLucas, the fibroid collective, the embolization process. That's the only way, that's if you want, yes, I still do.
Yeah. And
Yes.
so does chat. What is it? Chat
Chat GPT.
chat GPT, you know. I got to be able to, you know, and I can't say that I really knew a lot about the internet, except that was the only way back in the 90s that somebody like your mom
Mhm.
would find out that there was an option to
Mhm.
anything except hysterectomy. And um, yeah, I mean, it's, you know, it's a testimony to
Yeah.
women who are as independent and wonderful
Mhm.
as your mom, that they would find us and others, find us and others. Well, ladies, I know you have nothing better to do than to talk to us for the rest of the evening, and I would love to continue the conversation, but pretty soon we'll get into baseball, and then we'll have a
Oh,
major difficulty talking about these things. But I just need to say thank you to both of you. Natalie, thank you.
thank you, Dr. McLucas. And if
And
there's any way or anything I need to do to get the word out, I'm still here and available, and Lauren as well.
Yeah, just don't wipe out in your first outing on the
Oh,
car,
okay.
Oh no,
Yeah,
no.
we've come too far to have a
Yes.
miracle baby here, so let's not throw that away.
I will not. Yes.
All right.
No, anything at all, please let me know.
And doctor, thank you for my mom, I guess, and allowing me to be a part of her life in this whole
No, thank you,
journey
Dr.
and
McLucas.
process.
We do thank you. You are in our hearts forever.
Well, there has to be a first, and you are the first.
Wow.
And there's been hundreds of thousands of women after, but you know, it's when you're going off that cliff,
Yeah.
you just hope the parachute opens, and I'm so glad it did.
Yes. Thank you.
Okay.
Thank you so much.
All right, everybody. It's time to go back to whatever you'd be doing on a Tuesday. What I'm doing here, I could go on for hours just talking to these wonderful ladies. But thank you both.
Thank
And we're signing off. Thank you.
you. Good night.
Have a good night. Okay. Okay.
I didn't do